Hello, Healing Spot community. This is Justine Calderwood. I'm a physical therapist here at the Healing Spot, and today we are talking about how to do a self-perineal massage. And I'm going to take it one step further and call it pelvic floor massage, okay? So why would you want to do this? There's a couple different reasons. One, you might be pregnant right now and you might be in the later stages of your pregnancy and preparing for a natural or a vaginal birth. So you may want to connect to assess your pelvic floor to see if it's hypertonic, meaning is there too much tone in there and is baby going to be able to come out? So that's one way or one reason that you might want to do a pelvic floor massage. This is preparation for birth. You might have pelvic floor dysfunction, so you might be struggling with things like leaking or prolapse or painful sex or other pelvic floor issues, including pelvic pain. So that might be one reason that you want to assess the pelvic floor and to do a massage to work on any tight or restricted areas. So let's see, you might also want to work on this postpartum. So if you had some tearing of the perineum or if you had an episiotomy, so those are some reasons that you might want to do this. If you've had any kind of trauma into the pelvic area or injury, if you're a female, so we're going to go over the female, how to do this. And some of this work is based on the work of Tammy Lynn Kent. You can check out, she has more to say about pelvic mapping in her book, Wild Feminine. I'm going to go over the nuts and bolts about how to do a self-perineal massage. And I suggest reading her book and finding out some more information because she actually talks about more of the energetics of the pelvic bowl and what they represent. And so according to her, she's a physical therapist that's been doing pelvic floor, women's health, PT for quite a while. And she believes that certain parts of the pelvis represent certain aspects of that's kind of showing up in our life and that energetic piece. So I won't go too much more into that, but it is part of what I work with when I work with women in my practice. So, okay, so how do you do a self pelvic floor massage? So I have the female pelvis here, so I'm going to go over just a little bit on that. The best way to do this is actually get in a comfortable position. You might lean up against the headboard of your head. You can bring your knees out to the side. You know, you're gonna let your legs hang open so that you have access to your pelvis. And you can put a pillow underneath each knee if needed for comfort. So if you have tight adductors or inner thigh muscles, your legs might not have the flexibility that they need in order to do this. So support yourself in any way. Sometimes people do this in a bathtub where you know, they can be unclothed and they feel a little bit more comfortable there. Again, if you don't have water in your bathtub, you can put some pillows along the side, okay? So that's a good way to actually do this. You might have a mirror handy so that you can, you know, take a look at things. So I've talked about work, like self-work in the pelvis before, and I know this can bring up a lot of negative emotions for people, okay? So if you've had any kind of trauma or injury to your pelvis, or, you know, cultural beliefs, religious beliefs, you may feel like you're not allowed to touch yourself or look at yourself, that's not an allowed thing, okay? So if this is something that you desire to do, you may feel shame. You may feel some negative emotions come up as you do this. And what I encourage you to do is just let them come up, okay? This does not have to be a shameful thing. There's a lot of different functions of your pelvic floor, and it doesn't all revolve around sexuality, okay? So it's okay to look at your own body, to touch your own body, okay? So as you do this, I'm going to just kind of orient you here to the pelvis. So this is looking at a female pelvis, the bony structure here. The spine is stacked up along the backside. So as we look at this from the inside, we look at the bladder sits right behind the pelvic bone, the pubic bone. Then you have your uterus, okay? And if you've had a hysterectomy, you may or may not have this, okay? If you've had a hysterectomy, you don't have it. And then you have your rectum. So front to back, you have the bladder, uterus, rectum, okay? So I'm just going to take these out so you can see. Inside here, you can see the pelvic floor muscles creating kind of like a basket or a sling. So we can see those from the inside, okay? And if I tilt this back. So this would be if you were lying on your back. This is the orientation that we would be looking at. And we look at the pelvis as a clock. So at 12 o'clock is up. That's going to be the pubic bone. Okay, again, right behind that is the bladder. Okay. If we go to, so when you're looking, basically you'd be feeling yourself. So you're looking at 3 o'clock position would be the left side. Okay, you have your sits bone here. We come down to the 6 o'clock position. You have your coccyx, and you can see the anal opening there, vaginal opening here. And then we come up here would be your right side, and that's going to be the 9 o'clock position. So we go around the clock. Okay, and you can see these pelvic floor muscles. If I take off this part that has the vaginal and anal openings, you can see the basket. Okay, so these are the muscles that we're talking about, the levator ani muscles, just collectively the pelvic floor muscles. Okay, so I'm going to put this back on. So first, what I have found, because I've done this as part of training to assess myself as well as learn how to assess and treat other people. Okay, so I understand, you know, the emotions that can come up when you do a self pelvic floor massage, okay, or assessment. I completely get it. So what you're going to do, you can either, you can glove up, you can use a glove if that feels better, and you can use some lubricant so that you can easily slide in here to the vaginal opening. You can use a finger, okay, or two if you prefer. It may be better actually kind of ergonomically if you use your thumb, okay? It's just a little bit awkward to kind of come in with the finger, so it's okay to use your thumb. If you're working on the left side here, find it's a little easier if you come in with the right hand, okay, and you're assessing the left side, and then to assess the right side if you come in with the left thumb, okay? So we look at this as a clock, but we also look at it as a tube, clearly, that can go in, okay? So you can, you know, look at your thumb, basically, if you're using that if you go just right into the entrance, that's the first layer or the superficial layer of the pelvic floor muscles. If you go into that, the first thumb, the first joint of the thumb, that's going to be the second layer. And if you go in all the way as far as you can, that's going to be the third layer. So we look at it as a tube. And so you may find restrictions in the first layer and not the second and third, or any of those combinations. You might find nothing in the first and second layers, but find some restrictions all the way into that third layer. Okay, so I do suggest you assess this. So we look at basically from 3 o'clock to 9 o'clock position, kind of the bottom. Okay, that's the pelvic floor muscles. So we're looking at the 3 to 9 o'clock position, and we're also looking at how far in, so different layers. So you may check, you know, let's say at the 3 o'clock position, the very superficial layer, so you're right in just, you know, at the fingertip, you're kind of right into the opening of the vagina, and then you can go kind of a little bit further in and check all those different areas, okay? So let's see, you don't want to be pressing down at 6 o'clock. Your rectum sits right there. I went over that a little bit ago, so we're just kind of orienting you there. So as you come into the vaginal opening, we're not going into the anus. As you go into the vaginal opening, you're right at 6 o'clock. If you're right at midline, you don't want to be pressing there, okay? We don't want to be stressing out your rectum. You can come on either side of it, and you can kind of feel. If you have any stool in there, you might feel that. Not that you're in there right there, but you can feel that firmness. So you want to just be on either side of that, and that can help you to assess the position of the coccyx, okay, and if there's any tenderness there. So what you're looking for is springiness, kind of like a trampoline. You want to have some springiness to your pelvic floor. You don't want it to be like, you know, like it doesn't have any kind of give. So this might take a little bit of feel and practice to find out, okay, how does this side feel versus the right side, okay? And if you come to any areas that feel, I'm going to say hot, hard, or tender, because that's part of the training that I've done. So if it feels hot, like it's giving off some heat, if it feels tender to touch and it's giving you any kind of sensations like burning, or it feels pokey, if it just doesn't, it shouldn't hurt. Okay, it should feel like any other muscle in your body. If you press on it, really shouldn't be hurting when you press into it. Or if it feels hard or like super firm, okay? So those are the areas. If you find any of those areas, you're just gonna pause and you're going to allow your body to kind of invite your thumb into the tissue and melt down. So you never want to force, you never want to go into the tissue and make it move or make it release. All you're doing is holding there. So I'm going to kind of use this. So as you hold there, if I were to feel like a hot, hard, or tender spot, and I'm just going to press into it, and I'm going to wait for my body to release, okay? So when we're releasing this, it can take 2 minutes, it can take up to 5 minutes or longer, okay? So give your body the opportunity to release. If it's not releasing and it's just staying hot, hard, or tender, it's not ready to release. Don't force it, okay? Because there could be backlash on that. Your body just simply is not ready to release that, and don't make it, okay? So you want to bring your breath and awareness into that. So as you're pressing, you just want to breathe into that area. There might be, restrictions happen for many reasons. It might be a structural thing where maybe there's a little bit of scar tissue there. Maybe you've had a baby, there's a little scar tissue there. That can happen quite frequently right here at the perineal body. So as you go into the vaginal opening here and you press down, and I'm talking about very superficial, just at that very first layer. As you press down, if you've had an episiotomy or any kind of scarring there, that can get overstretched and it can tear during childbirth. And so you might want to just even work into that area, okay? And as you connect with that area and bring breath and awareness there, you may find that maybe there's an emotion there. Maybe there's a little bit of fear that's been stuck in your body from this childbirth, okay? Or maybe there's been some trauma into your pelvic area, and that's what your body's holding on to. So allow yourself to feel those emotions, okay? Whatever they might be, okay? And again, it just might be a physical, structural thing that just needs to soften and allow the flexibility back to your body, okay? These tissues should be nice and supple and elastic. They shouldn't be hard. They shouldn't be immobile, okay? All right, let's see. Oh, one thing that you can actually do is you can have, use the one hand, one finger or thumb that's assessing. You may even just slide up underneath your own bottom, up underneath the sits bone, okay? If you're working on this side and you're kind of over by that 3 o'clock or 9 o'clock position, you might want to just support yourself underneath that sits bone. And you can just slide underneath there and feel that bony structure, okay? Or you might want to be, if you're working more along the midline, not at the rectal tissue, but just on either side, maybe at 7 o'clock or 5 o'clock position, you might want to just slide your hand up directly underneath the midline at your tailbone, okay? And that just helps you connect between your hands, and it helps to release the tissue even further, okay? Checking my notes here to see if there's what else I need to cover with you. The other thing that I want to mention is the significance of the anal sphincter muscles. So you can see them, okay, they go around the anus, okay, and they can come up. You can see how they come up to the perineal body, and they actually continue on up into these superficial layers of the pelvic floor. And so with childbirth, or even if you've had, say you have chronic hemorrhoids, or if you strain a lot when you go to the bathroom, you don't have to be a mom to have these issues, okay? You don't even have to be female to have this particular issue. But you may have some scarring or even like an anal fissure right along this anal sphincter tissue, okay? So this is also an area that I'm going to encourage you to assess. So to do that, if you're female here, you're just going to you can put just one finger just into the vaginal opening, and then you're going to use your thumb. So you're kind of going to use this pincher grasp, okay? And you're going to pinch the tissue very gently. And you can assess with your thumb, you can assess the top half of this anal sphincter muscle and then the bottom half. So you kind of use your the pad along the top of your thumb, and then you can kind of just press in very gently with your fingernail to assess the bottom half. Okay, so again, we look at this just like we look at the pelvic floor muscles as a clock. We look at the anal sphincter muscles as a clock. Okay, so you don't have to go into the anus to assess or treat. It might actually go in a little bit, but we're really talking about these superficial muscles right along there. Okay, when you're releasing that. All right, so that's kind of all I had planned for today. If you are pregnant and you want to be assessing this, I've heard conflicting, like when to do this during pregnancy. I've heard some people be very, very conservative and say don't do any kind of internal work the whole last trimester, okay, the final trimester. And then I've heard other people say they like to assess this, practitioners I'm talking about, that work with the pelvic floor, that say they wait until week 37 gestation during pregnancy before they do this. So I have my own philosophy on that, but if there's any contraindications for pelvic floor work, as far as if you have been put on pelvic rest, no sexual activity, then you shouldn't be doing this either, okay? So always err on the side of conservative, and obviously you're gonna use your own best judgment for that. You can always check in with your medical provider and ask them, hey, I want to do this, is this safe for me, okay? So that's my caveat. Please take caution with that. And if you do have any questions, please reach out to me. I actually will be sharing this today with my Body Aware class. I'm doing a pregnancy preparation class, and I wrote this out for them step by step. I'm going to go over with this with them as well. If you'd like a copy of this, if you're really curious, comment below, and I can email this to you. So I'd be happy to share. Okay. All right. Thanks for watching. Leave me any questions below, and I will do my best to answer them. Bye bye.